Hi, my name is Mr. Hove. I'm from Bluefin Vision. This video explains the risks of cataract surgery. Now, the risks of cataract surgery are extensive, and typically when you come and see me for a consultation, we will send you an informed consent document which details all the risks. But in this video, I'm just going to go through the main risks of cataract surgery. It's never pleasant talking about risks, but the first one I want to talk about is the risk of losing your sight from cataract surgery. So we quote a risk of 1 in 1,000 to 1 in 10,000 of sight loss during cataract surgery, either from a bleed which occurs during the surgery. So this is blood that's in a blood vessel plexiform underneath the retina, and you have a catastrophic bleed during surgery which causes you to lose the sight. That's realistically more like 1 in 10,000. It is incredibly rare. The other reason that you could lose your sight is if you get an infection in your eye after surgery. Again, with the advent of intracameral antibiotics, which we put inside the eye at the end of surgery, endophthalmitis, which is an infection in the eye after cataract surgery, is incredibly rare. The next risk to talk about is posterior capsular rupture. This is a more common risk, and this has significant impacts on the patient's eye. So the capsule is the bag which holds the cataract, and during cataract surgery, the aim is to make a small hole in the capsule to suck out the cataract and put the new plastic lens in the original capsule. Nationally, in 1.1% of patients, this capsule is damaged during the cataract operation. The consequence of damaging the capsule depends on the stage of the operation. If the cataract has already been removed from inside the eye and you damage the capsule, then you'll need to do a procedure called a vitrectomy to remove any vitreous which comes from the posterior chamber from the back of the eye into the front of the eye. And then it is possible to put a new lens in front of the capsule, not necessarily in the capsule because the capsule has been damaged. And the operation might take significantly longer. Instead of it being a 5 to 10 minute procedure, it might take half an hour. And the vision, instead of recovering over 2 to 3 days, might take a couple of weeks to recover. But in the vast majority of patients who have posterior capsular rupture, the vision still recovers well, comparable to the other eye. If, however, the capsule is damaged while the natural lens or cataract is still in the eye, then that lens can fall through to the back of the eye. And if that happens, you need to have a second operation on a different day to remove the lens from the back of the eye. The risk of having a dropped nucleus requiring a second operation is about 1 in 300 cases. My risk of having a dropped nucleus is more like 1 in 1,000. It is incredibly rare. The next thing to mention is that if you are having a premium lens, then that premium lens will give you glare and halos. Glare meaning lights are brighter than you remember, and halos being rings round lights when you look at pinpoint like oncoming headlights, or when you look directly at street lamps. Every patient getting a premium lens will have some degree of glare and halos. The vast majority of patients adapt, which means they get used to it. Very rarely you put a premium lens in some patients and they don't adapt, even if you wait 6 to 9 months, and then you have to remove that premium lens and put in a standard lens which won't give them the glare and halos. In all the 8 or 9 years I've been doing private practice, I'm yet to remove a premium lens because I'm very careful who I put the premium lenses in. If I don't think you're suitable for a premium lens, I'd rather not do the surgery because I don't necessarily want you to have 2 operations to do 2 eyes and put premium lenses in, and then another 2 operations to remove those premium lenses subsequently because you don't get along with them. The last major risk factor to explain is that when we do cataract surgery, the aim is to correct your prescription typically so that your eye has an overall prescription of 0. And in about 1 in 20 patients, that the overall prescription after the operation is about 1 diopter. If it's minus 0.25, minus 0.5, minus 0.75, or the equivalent plus, you don't really notice it and has no visual significance. But 1 or more, that eye will not be in focus, and so typically we will need to subsequently go back and do some laser eye surgery or put a piggyback lens on top of the one that was in there to correct that residual refractive error. If you're having your cataract operation in the NHS and you're left with some residual refractive error, they will just tell you to go and buy some glasses. The reason we do it differently privately is because if you're having surgery with the aim of reducing your dependence or need for glasses, then saying, well, we're really sorry, this eye hasn't quite turned out as planned, go and buy some glasses is not a satisfactory outcome. And so if you're a self-pay patient and you need to have enhancement, it's included in the price that you pay. If you're an insurance patient and you need to have enhancement, then unfortunately that comes at an extra cost, which we outlined to you before you have your surgery. Like I said at the beginning of the video, the risks of cataract surgery are extensive, and when you come in for consultation, we provide you with an informed consent document which details all the risks, but those are the major ones that you need to be aware of. Thank you.